And Alicanto is a platform where both doctors, nurses, and other healthcare professionals can meet online, have collaborative spaces to share educational material through their library, and this could be the latest evidence based knowledge, but also have collaborative spaces for groups to meet online and then create new practice guidelines or create virtual tumor boards to be able to meet and discuss difficult cases. And we deployed this in 2019. Versions of Alicanto had existed for a few years before that we had piloted at other hospitals, but at BI it went live in 2019. And in January 2020, we started having our first virtual tumor boards across the cancer network. And as you'll recall, in January 2020 is when COVID sort of started appearing within the United States. And so it was a very timely opportunity to be able to use this platform to provide a way for our doctors and nurses and other staff to be able to collaborate online. So the reason it's called Alicanto is because as I view healthcare, we live in a lot of silos. We have different systems that are sort of islands unto themselves sometimes. We have different groups who sometimes don't communicate enough. And Alicanto is trying to integrate communication and access to information and collaborative tools. It's based on a mythical bird from southern Chile, where my ancestry comes from, and it's a country of mines. And this mythical bird glows in the darks and helps miners come out of mines. And so Alicanto is sort of like that. It's a platform that allows people to sort of be able to communicate no matter where they are in a large hospital network and to be able to work together. Over the last year, the platform has grown in use. We have over 1,000 users, and about 800 of those are part of the cancer community, not only at Beth Israel, but on community hospitals, and we have a growing number of users using this. And this gives you just a very high-level overview of this system that allows information for different groups and to be able to both provide online education, virtual tumor boards, and more recently, we're using it for patient referrals. And so I'd like to pass it over to Dr. David Einstein, who will be talking about the implementation, and he has been one of the key leaders who has had tremendous success in using this within the platform. And I will ask David to talk about his experience in leading the growth of this platform. David?
Sure. So thanks again for having me, and big thanks to Yuri for working with us through the trials and tribulations of COVID and all the clinical challenges that we encountered. So before COVID, we in GU Oncology had a very good collaborative group composed of medical oncologists, radiation oncologists, urologists, and then we would meet weekly with our diagnostic radiologists and pathologists to go over cases and talk about challenging case management. In the old world, when we were meeting in person, we would send out a weekly spreadsheet full of individual cases that had been emailed to one central receiving person, and then that list would go out, but inevitably there would be a lot of last-minute add-ons and multiple versions of Excel spreadsheets created. It's a very inefficient system. And so those were some of the challenges that we were facing, especially as we started migrating towards virtual tumor boards. And so we'll talk a little bit about how we've tried to address that within GU. But we're composed of the group at BIDMC with these different subspecialists, and then increasingly we're practicing as part of our network with outside medical oncologists and urologists wanting to meet with us and review cases or ask us for second opinions. So that sort of highlights the group collaboration efforts that have gone on, as well as these virtual tumor boards that we're using for case discussions. One thing that we had never done before that we're now potentially able to do with the new system is to actually review all the cases that we have been discussing and mine those data for quality improvement purposes. And then finally, for an education perspective, this is very useful since a lot of the questions that we wrestle with in tumor board are the key controversies in the field, and so we can then use that to develop training for fellows and have an educational component as an academic institution. So you'll see over on the right side here that we have a variety of different groups with different memberships. We've been using the BIDMC GU Oncology for our virtual tumor boards. And then I belong to several of these other groups as well that have different reach. So we can go to the next slide. So here is a view of the homepage when you come in to Alicanto and then click to one of these groups. You'll see that there are a number of options across the bar with the option for scheduling video conferences that are hosted by external services. We can post resources and have collaborative tools, things that we're commonly referencing, things like practice guidelines or state-by-state telemedicine requirements. These are things that we're frequently trying to go through buried emails to find, but now we can post them in a central location. We can manage our membership, and then we'll get to the consult system as well, which is how we organize our tumor boards and have started to organize our network referrals. Next slide. So here is an example of a video conference. This is our virtual tumor board that has been happening weekly. And we can meet online for these case discussions that we used to do in person. Notably, even as we have all gotten vaccinated and can now spend time with each other in the same place, many of us feel that probably we will never go back to in-person meetings because it's so much more efficient to do it this way and because it works out so well with the network-based practice. So if we wanted to submit a case for discussion at Tumor Board, we could use this consult system either via this browser-based entry or via an app. We can go to the next slide. So if I were to enter the consult system, I would have the option for creating a case. And this case form has a lot of different data fields that we can customize depending on the needs of each group. And moreover, when we use this as a case submission system for referrals, there's going to be a different set of questions versus the questions that we're going to ask of a patient being presented at Tumor Board. So we indicate our group, where the patient is being cared for. We have a subset of diseases that's specific to GU. So a breast cancer case should not be discussed at GU Tumor Board, so there's only GU cancers to choose from. We indicate some basic demographics. We can indicate a date to be scheduled. And if an admin or a nurse is putting in a case for an attending physician, they can indicate who that attending physician is. Otherwise, if I'm doing it myself, I don't need to indicate that. So I would add a brief case description and some questions for discussion. And then I think a real highlight of this system is the ability to tag key specialties. So, a lot of times we're reviewing diagnostic images and or pathology results, biopsies and specimens. And it's very helpful for the people who are presenting these at our tumor board to know in advance which cases to pull and review. So we can indicate whether or not we have a pathology question or a radiology question, and the receivers on the other end can actually set their notifications to be notified specifically when there is a pathology request and or a radiology request. Next slide. This is the case dashboard. So once I submit that case, it would appear on this case dashboard. And I can customize my view to see multiple groups or just one group. You can also sort things. You can archive old cases and view them or not as you wish. You can organize them by, you can sort the list by each of these variables across the top row. You can also filter, for example, by I only want to see prostate cancer cases that have been submitted within the last year or so. That might help me with QI or research projects. And then finally, you can export this dashboard, again, for QI and research efforts. Next slide. So this is the mobile app that's been developed as well. So frequently we're working off of our iPhones or our iPads in clinic. Frequently we're not sitting by one desktop throughout a whole clinic session. And so this app is really invaluable for being able to enter data and review on the go. So you can set up notifications and get notified that way of meetings and content. You can join meetings through the app. We can access our groups. Importantly, we can access the consult system. So if I'm sitting in the clinic room with a patient and I have a question that I want to make sure is addressed at tumor board, I can right then and there click the consult button and enter all those case details so that I won't forget to do it after a busy clinic session. There's a library where we're beginning to develop practice guidelines and online learning videos, including even videos for how to go through this system and set up your own tumor boards. Next slide. So this consult system is really a system within a system, and we've been using it for anything that requires patient protected health information. And it is stored in a secure server behind a firewall, requires two-factor authentication on the initial login, and then if you have your cookies set, subsequent logins don't require an additional two-factor authentication. So within that consult system, we've built a variety of tumor boards, and then increasingly we're trying to use the same system to manage the many patient referrals that go between individual hospitals that are parts of the network. At the moment, the sort of gold standard for referring patients to other hospitals in our network is really sending an email with patient details to somebody, and who that somebody is depends on you knowing who that person is on the other end, who's responsible for receiving those cases, or emailing, a colleague at a different hospital. That colleague might be away on vacation or might be, overwhelmed and have somebody else who really should be taking the case. And so our hope is to use the same system that we just described for tumor board to also handle these patient referrals and organize all the information centrally.